Tommy John was an outstanding basketball player at Gertzmeyer High School in Terre Haute, Indiana, where he held the city single-game scoring record. Choosing baseball when he realized he would not go on to play professional basketball, John signed with the Cleveland Indians and made his major league debut at 20 years old in 1963. Following 2 partial seasons with the Indians, John showed occasional excellence during 7 respectable years as a starting pitcher with the Chicago White Sox. In 1972, Tommy John joined the Dodgers as a pitcher. In 1974, Tommy John was the first man to ever have this procedure done. That is why people call it Tommy John surgery, but it's also known as ulnar collateral ligament reconstruction.
Hi,
Hi,
I'm Gerard Pickerberg. Nice to meet you. What's your name?
I'm Keith Newman.
So, I noticed you had some baseball attire on.
Yeah.
Have you ever gotten Tommy John surgery?
Yes, I have. Twice, actually.
Oh, really? Do you know where it came from, the name? Why is it called Tommy John surgery?
Well, in 1974, a man named Tommy John, who was on the Dodgers, ripped a tendon in his elbow. And he got the surgery done to reattach the tendon, and they named it after him. And the chances of survival in the year when it happened, it was 1 in 100, and now it's a lot higher today. But since he was the first ever person to have it done on, they got it named after him.
Oh, it's interesting. Thank you for your time.
I see you play baseball for the San Marino Titans.
And for the Angels.
Oh wow, that's nice. So I was just walking around today in this nice, beautiful park, and I was talking to people about Tommy John surgery, and I was wondering if you ever had it.
Yeah. About 22 years ago. It was a big day.
Can you tell me how it works, Tommy John surgery?
Yeah. So basically, let me just put that down there. They kind of do their thing here, and then they drill 2 holes, one in my ulnar bone and one in my humerus bone, to accommodate the new tendon. So
Interesting.
This picture is an MRI of a baseball pitcher. The yellow arrow points to the ulnar collateral ligament, which is also known as the UCL. The red arrow points to where the UCL should attach onto the humerus, but since there's a tear, the UCL is not there.
My name is Ace McNorman. What's your name?
Norman Montgomery.
Well, that's a nice name you got there, but anyway, so today I was wandering around town and I thought to myself, I should go and grab a microphone and talk to people about Tommy John surgery, and so I did it. So I was wondering if you could tell me about rehabilitation of Tommy John surgery and what it's like.
Well, it takes about 1 year for full recovery, but 1 year for pitchers and like 6 weeks for the position players. So that's how they.
And I hear that pitchers begin throwing about 6 weeks.
6
after
weeks
surgery.
after, isn't that crazy?
Yeah. Okay. Well, thank you for your time. My arm! My elbow! I think I need Tommy John surgery now.
Are you okay?
My elbow.
What happened to your doctor?
It hurt. Oh wow. Okay. My elbow hurts a lot. Can you take a look at it for me?
Come on, let's go to my laboratory.
Okay.
During Tommy John surgery, 2 holes are drilled into the humerus and the ulna. A tendon is looped just like a figure 8. The surgery recovery takes about 1 to 2 years. Anyone can get a UCL injury from repetitive stress to the elbow, but throwing athletes have the highest risk. That's because throwing motions that twist and bend the elbow put extreme stress on the ligament. The ligament stretches and lengthens to the point where it can't hold the bones tightly enough during throwing activities. Most sports-related UCL injuries occur in baseball players, but other sports are sometimes linked to UCL injuries too. These sports include tennis, gymnastics, soccer, softball, football, wrestling, and cheerleading.